Hello, this is a Brighter Futures film about how research can improve policy and change lives. It's a great pleasure to welcome Mariachiara Di Cesare, who's the new director of the Institute for Public Health and Wellbeing at the University of Essex. So we're going to be talking about public health and the challenges that we face. So let's start a bit about the Institute then, Mariachiara.
Oh, thank you so much, and thank you so much for the invitation. So the Institute and started in February of this year, and we really was a community from the university, a community effort to bring together all the great work that University of Essex is doing in relation to health and well-being, public health, health and well-being. So what we did is really to bring together all these strong researchers across the university that are doing a lot of great work to change the world, to improve the health of the population, and to have a great impact on the population. So it's really a multidisciplinary institute. It's not siloed in the traditional public health and well-being environments. What we do is that we bring people from law, life science, health and social care, math, psychology, sociology, economics, all together around the same table to discuss the major challenges that we are facing locally, nationally, and internationally.
So we start by looking at what those big challenges are globally, which need this kind of cross-disciplinary approach that you've said. So it's driven from how you can make an effect in the world, is that?
Yes,
yeah.
Yes. So the Institute is really impact-oriented and partnership-oriented. So what we want is to work on strong pieces of research that reflect the real-world issues. So for me, this is a very important and critical word, is to say we are not disconnected from what happened in the world, and to ensure that we can translate through partnership into impact and policies. This means that we cannot do in the silo of academia, but we need to constantly work with partners, so local, international partner. It could be partner in the regions, local authorities, NHS, or international organizations like the World Health Organization or the World Health Federation, other organizations, because we need to know what is the real problem, and we need to know what the frontline worker needs to do and what they need from us to improve the health and well-being of people.
And the world is changing, so we need new approaches to deal with that, and aging, but also a shift from the burden of ill health, moving from infectious diseases largely towards what are called non-communicable diseases, which are not really diseases, they're conditions of living,
chronic,
aren't they?
Yeah.
So tell us a little bit about that, because I know.
And I think this is also a bit of the area of research that I'm interested in. I'm very focused on cardiovascular health. And I think that globally what we have seen is exactly what you were saying, a shift from infectious diseases to what we call non-communicable or chronic diseases. So our condition that the majority of people need to live for the rest of their life. So I'm thinking about cardiovascular diseases, diabetes, cancer. So we need to think in a different way. And when we look at the list of what we call leading cause of death globally, non-communicable diseases, chronic diseases are the top globally. But also when you start looking into even countries, you see that a lot of countries have those diseases are the leading cause of death. Now, I think it's also important to think that there is a difference, of course, between low-income countries and high-income countries. But still, especially for non-communicable diseases, when you consider, and I know this is a concept a bit complicated, but I'll try to simplify as much as possible. When you consider that low-income countries has a much younger population, and when you try to consider, well, these are younger population, what you see when you adjust for this kind of age structure, what you see is that, in fact, the level of mortality for non-communicable diseases, chronic diseases, is higher in low-income countries than in high-income countries, because the level of mortality is higher because of access to diagnosis, access to treatment, care, etc. So what you see is that it's true that we still in low-income countries, we have a large burden of infectious diseases, but in fact, this is going to change as soon as the age structure of the population is going to change, and we will see
So by definition, the idea of disease being something that requires a very specific intervention, which may be the case if it's an infectious agent, you know, you take something and it makes you better. We're talking about the impact of our lives in the way that we live them, the whole of our bodies, the whole of our social structures,
Absolutely.
which needs a cross-disciplinary approach by definition.
Absolutely. So when we start looking at the biological, social, cultural, environmental dimension, those have an impact on our health, definitely. And when we start talking, as you said, biological, environmental, culture, we cannot do just in the silo of one discipline. We need the input from everyone, and how our socioeconomic status, how we are able to afford access. I think about food, for example, healthy food, that makes completely a different story for our health, right? I mean, if we can access healthy foods, or if we cannot, or if we can access enough food. So I think it's really, and that is just to give you an example, this is really an important element. And what I think is also important to highlight, that globally, we are still, I mean, if we think about development assistance flow of resources, the resources that go for chronic diseases is just a little
small.
It's very, very small compared to infectious diseases and yes, as particularly maternal infants and HIV, tuberculosis. There is the majority of funding are going in that direction. So we really need to change and change also the way that we think globally about chronic diseases.
So we'll take us to that global picture. You've worked with the World Health Organization, WHO, in seeking to influence the way they look at these things. So you've got world-spanning organizations, the most important health organization globally, with a view on lots of things. Tell us a little bit about how you've worked to kind of influence their approach, which is often one without very much money. They've got to get it from elsewhere, but that's the trick of linking up the research to the policy to the influence, I suppose.
Yeah. So I think I can give you a couple of examples. One is definitely the work that I've been doing with, in collaboration with other institutions, that is to generate estimates for cardiometabolic risk factors. So we are talking about diabetes, hypertension, obesity. So that is the info. So my area is really to measure things. So if we cannot measure, we cannot change things. So for me, the measurement is a very important dimension of studying health and then influence policies. And to influence policies, you have to have the best measurements possible. So my focus has been a lot on generating those estimates for countries and for the WHO to then go to the different countries and ministry and to say, look, this is the status of the health of your population in relation to this specific area, that is cardiometabolic risk factors. The other example is the work that I've been doing with the Global Nutrition Report on malnutrition. I think this is another area that is really, really important because, again, we are talking about double burden of malnutrition there. So we are going to experience in countries that still have undernutrition, still have stunting among children, undernutrition among adults, but at the same time they are emerging in terms of overweight and obesity. And often you can have those two in the same family. So in the same family you may have parents that are overweight, obese, and children that are stunted. That means that they really lack nutrients during their growth. And so
we've got to think in different ways with this.
Yes, we need to absolutely rethink, because you cannot tackle just one and ignore the other. We need to be creative, also because we are in an environment in which resources are limited, right? So we have a limited amount of resources, but we need to do everything. And we cannot ignore an emerging issue because we are focusing on the other, but we cannot focus on the emerging one and forgetting about the previous one. And there we work with also directly with country and donors and organizations to see what are you doing? What are you doing to improve malnutrition? What is your action? And we help them to monitor and follow up those commitments, economic commitments, human resources commitments that they do during the big summit around specific on malnutrition. So I think that there, the other way is, again, measurements, because again, it's really my focus, but is understand what did you say that you were going to do? Well, we help you to follow up and see whether you are achieving what you said and whether your investment, again, it doesn't need to be financial, your investment is producing the outcome that you were hoping to.
Well, that brings us obviously to COVID, the biggest threat to public health across the world, a genuinely global problem that touched almost every human in the world. Everybody knew about it or knew about the effects of it, and the rolling kind of crises that have come from this. So COVID had an effect, but then our response to it had an effect as well that will go on for a long time, wouldn't it? So how are you thinking about these challenges of global health in the context of this really big kind of shock, really, to the whole system?
Yeah, and I think there are two elements here. I mean, first one is COVID, that is a big example of how the global world and the global community, health community, has moved around COVID. And I think that we have made great things. I mean, the vaccine is the great example of how we can come all together, research, environments, private sector, all together to produce a vaccine in less than a year. That was, I think, a great example of coming together. We can do this. And I also think that locally we have shown, especially, for example, I give the example of the UK, how once you empower the healthcare system that is already in place to deliver the program, the vaccine program, that worked absolutely outstanding. I mean, that was absolutely. On the other side, I think we have learned how we are still not ready to really tackle global issues. And the example is, again, the vaccine. So when the first vaccine was available, there were countries that had secured already 5 doses of vaccine and countries that didn't have even one. And that is still thinking of a global issue as a national problem, not a global issue. And we have seen the consequences, right? That the virus kept circulating because we are in a global world. And we also experience what does it mean to be locked and not able to move globally. So I think that gives us an example of, definitely an example of great success, but how behind we are in terms of tackling problem globally. On the other side, COVID has really had an impact on a lot of the other health issues. Again, I think about food system, the impact of COVID on food availability, and I think about access to treatment or diagnosis. And we know that nationally and globally, we have left behind a series of people that had other conditions, and now we are trying to catch up with that. So we will see the consequences, not just as COVID, but as COVID on other conditions, I think, for many years to go.
And it's revealed some failings, hasn't it? I mean, poverty, people in the UK, the poorest had the highest death rates from COVID, which is kind of not really a surprise because they're in poor areas with poorer services probably, but also bodies are less able to be resilient and to fight it off.
Absolutely. So multimorbidity is there, and also, if you want, also the fact that maybe work-wise they couldn't really afford to stay at home, and then they were more exposed. So there you have and then I think about the kids of more vulnerable families being out of schools and what are the implications for those kids. So the impact has been not just COVID, has been on absolutely everything. And I really hope that we can learn something. I think that I really like the idea that we can work together. We have shown that we can work together, but I think we need to do much more than what we have done so far.
So final thought, optimistic or pessimistic when it comes to global health problems? I mean, we've come a long way in 30 years. Things have changed remarkably, even just over short periods of time. But when you look forward, the kind of desire really to make a difference, is that there?
My nature is optimistic, so I think things are changing. We have learned a lot on this. I was very optimistic about how much we can get out of the last 3 years. I think it's not easy. We need to all be together to reach and achieve what we want. That for me is just one thing, that is health for all, regardless if you can pay or not. So everyone should have access to the same quality of health in the world, regardless of anything else.
Chiara Di Cesare, many thanks. For more conversations on how ideas improve lives, pop over to our sister podcast, Louder Than Words.